7 in 10 people fear strikes by NHS staff are endangering patients, and the majority do not support walkouts by doctors. A survey for the Daily Express found 58% would be less likely to seek care when industrial action is taking place. The findings come ahead of another 4-day strike by junior doctors, starting at 7 a.m. on Friday. Some 41% of 2,000 adults quizzed by one poll last month supported the trainee medics' decision to down tools over pay, while 34% were opposed. However, support for consultants was much lower, with 34% supportive and 41% opposed. Rachel Power, boss of the Patients Association, said her group respects the right of NHS workers to strike. But she added, people are fearful of falling ill and needing care because they know how stretched services are. Patient safety is at risk, staff members are exhausted, and social care is unable to provide services people need. Following our survey, Health Minister Will Quince said, the public wants an end to these damaging and disruptive strikes at a time when the NHS is putting everything into busting the backlogs and cutting waiting times for patients. It is vital people who need it still come forward for care during industrial action. The NHS plans rigorously to protect urgent and emergency care, as well as prioritise patients who have waited longest for elective care. Mr. Quince added doctors in training were getting typically an 8% rise while consultants received 6%. He said, this award is final and we call on unions to put patients first and call off strikes. Some 34% strongly agreed that strikes by NHS staff put patients in danger, while a further 35% agreed. Just over a fifth were neutral and only 9% disagreed. Pressure will be even higher during this weekend's strike after the High Court ruled that employers cannot use agency staff to fill gaps. Hospitals can use their own bank staff, but health chiefs warn many are on summer leave. Matthew Taylor, boss of the NHS Confederation, said a resolution to the bitter dispute was desperately needed so services could focus on targets such as clearing waiting lists. He added, this situation is unsustainable, and it is clear that patients are becoming frustrated. With more strikes to come later in August during a crucial time where the NHS begins preparations for the tough winter months, leaders are increasingly pessimistic about their ability to meet recovery targets, the impact on patient care, and the toll it is taking on NHS finances. Almost 835,000 appointments have been delayed due to industrial action since December. NHS England says for around 450 hours services were without a third of their workforce in 4 previous junior doctor strikes. However, NHS providers warned the true impact could be twice as high because many hospitals stop booking appointments once strike dates are announced. Comment by Sir Julian Hartley, Chief Executive of NHS Providers. I cannot remember a tougher time in all my 20 years in the NHS. If thousands of doctors, junior and consultants, walk out again as planned this month, it will mark 9 months of industrial action. Lots of Express readers will have had routine ops and appointments put back. More than 835,000 have had to be rescheduled due to industrial action. The most recent 2-day strike by radiographers who do scans, X-rays and ultrasounds caused 13,000 delays. These alarming numbers don't tell the whole story, though, because every strike has a knock-on effect on many more patients who just don't get booked in on strike days. NHS Trust leader understands staff have been hit hard by the cost of living crisis after coming through the pandemic straight into one of the toughest winters ever seen in the health service. Industrial action is eroding already low staff morale. "We can't go on like this. It's up to the government and the unions to get together to find a way forward." Trust leaders want to get on with cutting waiting lists and providing better care instead of spending too much time rebooking patients and hiring expensive staff cover. While strikes continue, keeping patients safe remains our priority.